Good afternoon, everyone. This is WLVT's Ask the Experts. I'm Kelly Boyd, and joining me in the hub today is Dr. Ginger Stover of Baptist Cancer Center. Welcome to the hub.
Thank you.
Thank you for coming for Ask the Experts to give lots of good advice. We're going to talk about breast cancer and lymphedema today. And tell everyone about what your specialty is exactly.
So I'm a physical therapist, but I'm also a certified lymphedema therapist, and that's what I spend most of my time treating is this thing we're going to talk about, lymphedema.
Okay, because anyone can get it. It's not just breast cancer patients, right? All right, so we'll learn all about that today. Our questions come from the Ask the Experts page on WLVT.com, but if you have questions for Dr. Stover while we're live on Facebook, please join in the conversation. All right, first question is, what is lymphedema?
Well, lymphedema is a swelling, usually of the legs and the arms, caused by a blockage of the lymphatic system. Mm-hmm. And does occur in some cancer patients. We'll talk about that, I'm sure, more.
All right. Okay, so you mentioned the lymphatic system. Mm-hmm. Everyone might not know. I had plenty of A and P, but
probably didn't talk about the lymphatic system very much.
Not very much. Because didn't you tell me the other day they spend about 30 minutes on that in med school?
Yes, they did a big study. So it's the least understood system in the body. But it covers the entire body. Mm-hmm. They've now recently found that there is part of your lymph system in every single tissue of your body. Mm-hmm. What is the lymphatic system? There are some organs involved in it. It's a system that carries immune cells throughout the body. But the main thing that I deal with, it also carries waste fluids throughout the body. Transports them out of the tissues of the body. So it's a system that's composed of lymphatic vessels, which are actually clear. The cool thing to me is if they weren't clear, you could see them through your skin. They're not deep. You've got lymph vessels and you have lymph nodes.
Okay.
That I deal with. And the way it works is the lymph vessels are scattered throughout your tissues. Your cells that you're made of do their work and they make waste and they secrete it out of themselves. So then it's just out in your tissue. Mm-hmm. We need something to get rid of that fluid or we would all explode. So we have
right.
These lymph vessels. They absorb that fluid, and the ultimate destination of this fluid is back into the bloodstream. Mm-hmm. But before it's dumped there, it's kind of cool, it needs to be cleaned out. Mm-hmm. So that's what lymph nodes do. They filter that fluid. Mm-hmm. And they'll try to kill an infection, cancer, anything that's foreign that shouldn't be in that fluid. Mm-hmm. So that pretty much by the time the fluid's dumped back into the bloodstream, it's water and protein, and that's about it. Mm-hmm. So that's what the lymphatic system is.
So basically, it's a very important system that keeps us from exploding, right?
Yeah. Also helps with our immune system, but we're not going to talk a lot about that.
Okay. All right. What causes lymphedema in cancer patients?
It can be caused by several different things. The main thing that I see with my patients is they've had lymph nodes removed as treatment for their cancer. There was no option. They had to have them removed, mm-hmm. and so now they don't have those lymph nodes. Remember, those lymph nodes were the filters. A coworker of mine said they're little factory workers, mm-hmm. and their job is to take that waste fluid and clean it up before it goes on back into the blood. And when you don't have enough factory workers there anymore, mm-hmm. that fluid's still being made by your cells, and it just kind of backs up into the extremity if you don't have those lymph nodes. So that's the main reason, but also a patient can have cancer invading their lymph nodes. Okay. That would cause lymphedema. Okay. And then they could also have radiation to the lymph nodes, and that scars them, damages them, and they're not as effective at that point.
All right. Someone's saying they wish we had captions. Are you having a hard time hearing us? Let us know. We can make some adjustments possibly. All right. Let's see. We already said this, can you develop lymphedema if you don't have cancer?
Yes, you can. Some people are born with a deficit in their lymphatic system, not enough lymph nodes, not enough lymph vessels. Mm-hmm. They will develop lymphedema. And then there are other medical conditions that can cause an overload of fluid in your body. If you get an overload of fluid in your body, you overwork the lymph system, mm-hmm. you swell. Mm-hmm. So that could be venous insufficiency, congestive heart failure, kidney problems, liver problems. Those can all result in lymphedema.
Okay. What circumstances would a surgeon remove a lymph node?
This is breast cancer month, so we'll kind of talk about breast cancer mainly. In a breast cancer patient, they remove the lymph node if it has any cancer in it. Mm-hmm. They're also using that process of looking at the lymph nodes to stage the cancer. So they do have to remove lymph nodes.
One thing I didn't mention to you, Dr. Stover, so we're not always pink in here. We're just pink for our Power of Pink month that you guys have been our sponsor of over 13, well, this is the 13th year this year.
All right.
So Power of Pink.
Thank you.
All right. What effects does removing a lymph node have on your body?
So, like I said before, the lymph node is the filter. You've got all this fluid your body's making, and it needs to be filtered before it's just dumped back into the blood. So that's what the lymph node does. If you remove a lymph node, you don't have as many filters anymore. So you still produce the fluid. So the result can be swelling. Now, we all have 600 lymph nodes in our body. So hopefully, if you just remove a few lymph nodes, you won't swell. But you can swell.
Okay. All right. What effects does removing a lymph node have on the body?
That would be to make you swell. Also can affect your immune system. I'm not going to go into that, but the lymphatic system does play a big part in the immune system, so you may be more prone to infection in that area too.
Okay. How does radiation affect lymph nodes?
It damages the lymph nodes. They can be scarred. They're trying to kill the cancer that would be in the area, but they also damage the lymph nodes, so then they're less effective. So it can have the same effect as removing a lymph node.
Okay. All right. Can a cancer tumor itself affect a lymph node?
Yes. You can develop cancer. It's not very common in my patients that I see, but you can develop cancer. It could come from another part of the body, or there are certain cancers that actually originate in the lymph node. So you can't, if you develop cancer in a lymph node, again, the lymph node is full of cancer. It can't do its normal job, so you can end up with lymphedema.
All right. Can lymphedema be prevented?
In some cases. It just depends on how many, and everybody's different. So you never know how each body's going to respond. But if you've had lymph nodes removed, some people will never develop lymphedema. Some people are going to develop it no matter how careful they are. And then there's a small group of people that, if they're really careful, don't produce too much of this lymph. So you're thinking, okay, how do I make less lymph? Things
Tricky.
things that make lymph. So the lymph is the waste fluid your cells make. If you look at a muscle cell, if you make your muscle do a lot of extra work, it makes a lot of extra waste, which is the fluid we're dealing with. So you can help to prevent, if you've had some lymph nodes removed and you've never had swelling, then you need to just not overuse your muscles. That means avoid heavy lifting and a lot of repetitive things. And you may be able to prevent it. Also, you want to take good care of your skin. If the skin cells have to do a lot of work, in other words, healing a cut or a scrape, then they make extra lymph, which can then overload that lymph system that's already not perfect.
Probably to include keeping it moisturized, because sometimes when you get dry, you can get inflammation too, right?
Yes, and also you want to keep it moisturized. That's a really good point, because the skin is what keeps infection out of your skin. Out of your body. Keeps the germs from getting in your body. If you keep that skin healthy by moisturizing it, then the germs can't get in. You're less likely to get an infection.
Good point. Good to know. All right. It can lymph. Wait, no, we said that one. What is a sentinel lymph node biopsy?
That is a procedure that's relatively new in the medical field. Physicians began to realize in treating breast cancer, it used to be that the standard of care was remove the cancer and remove every lymph node that would get the fluid from that breast tissue, which would mean all the lymph nodes under that arm. So they began to realize, we're causing a lot of lymphedema by removing these lymph nodes, and they didn't even have cancer in them. So a sentinel node biopsy is a way that they can go in and find out which nodes would get cancer first. That's the sentinel nodes. And they do this during breast cancer surgery. They remove it's usually 1 to 3 lymph nodes. They remove those and send them to the lab during surgery. The lab slices them, puts them under a microscope, and looks, do they have cancer or not? If they don't have cancer, they don't remove any more lymph nodes. They can't put those back in, but they don't remove any more. If those sentinel nodes had some cancer, then they have to go in and take out all the rest of the nodes. So then that person will be more likely to get lymphedema. So sentinel node biopsy has decreased the incidence. People that have all their lymph nodes removed, or what we call an axillary node dissection, are 40 to 60% of them will get lymphedema of the arm after breast cancer surgery. Whereas if you have a sentinel node biopsy, the research shows about 7% of those get lymphedema.
Okay.
So.
Alrighty. And you're saying after that, and to prevent it, they can do, I guess, basic, you said not repetitive, nothing strenuous, but like basic daily tasks they can keep. Because I think if they don't move at all, that's just as bad, right?
Yes, I'm so glad you brought that point up. So you might be thinking, okay, I might get lymphedema, so I'm just going to not use my arm. So I didn't mention it, but those lymph vessels that carry the fluid count on the muscles around them moving to push the fluid through them. Mm-hmm. So we recommend all of our patients have a healthy lifestyle, exercise. You know, ideally 150 minutes a week is what's recommended. Walking is great. Water aerobics is even better. Mm-hmm. Yoga, move, but just don't lift heavy things like maybe more than 10 pounds with that arm alone. You could use the other arm to help if you have something heavy.
Probably don't want to do weightlifting, weight
training. Probably not. You can progress real gradually. Get a trainer to work with you and progress with the weights very slowly.
Okay.
And then you want to avoid, if possible, repetitive things like a whole lot of typing at once, gripping the steering wheel. I've had that make lymphedema come up in patients. Sewing a lot. Not to say don't do any of these things, but in moderation. Okay. 30 minutes at a time would be great.
Okay. Good to know. What is axillary reverse mapping?
That's an even newer technique. Again, these physicians are great. They're trying to prevent lymphedema because it is a lifetime of work to take care of it. You don't cure lymphedema, and we'll talk about that later, but they are trying to prevent it. So what they found is, some of these people, I'm taking only a few lymph nodes, doing the sentinel node biopsy, and they still got lymphedema. So what they found was that they were damaging some of the lymph vessels that were around the nodes that they took out.
Okay.
So,
and those are teeny tiny vessels, right?
Yes, and very delicate. But they found out that they can inject a dye into the area and they can tell which vessels would be draining that fluid from the arm. And they watch those very carefully during surgery and try not to damage them so that that fluid from the arm can continue to go to those other nodes. It's kind of cool.
That is unbelievable. So, it is very cool.
cool.
Yeah. All right. How long, I think we already know the answer to this one, how long does lymphedema last?
Yeah, I'm sorry. It is considered a chronic illness. Yeah, kind of like diabetes. Once you have it, but you can keep your diabetes under control if you eat right, exercise. Lymphedema is the same way. We as therapists can teach you how to keep it under control, but you do have to do those things the rest of your life.
Okay. All right. So what is chronic lymphedema? So it's a lifetime condition, but there's also a chronic
component. That would be a case where the patient just can't get it under control. So it's visibly swollen for months, years. That really can cause a lot of problems. Infection would be the biggest one.
Okay. So that's for one that's gone on a long time untreated? Or
yes.
That's where you see the chronic comes in. Okay. How do you diagnose lymphedema?
This really bothers a lot of my patients because there's not a lot of really good, like there's not a blood test you can do. There's some imaging now that we can do, but the gold standard for diagnosing lymphedema is history and physical. We talk to the patient. We feel their arm. We measure their arm. They don't like that because it's pretty low tech, but it is the gold standard. Really? You diagnose it that way, yes.
Okay. All right. What are the signs of lymphedema?
The early signs would be just a feeling of heaviness of the arm. Fullness is what I hear people say. Typically, and this, to me, I kind of wish it hurt a little bit so they'd pay attention to it because the lymphedema doesn't usually hurt. Now, there are a few patients who, for one reason or another, do have pain with it, and I'll be honest, they hardly ever get very bad lymphedema because they take care of it, because they have that little alarm that says, ouch. But for most people, it doesn't hurt. They'll notice that their clothes don't fit as well on that one side as they used to.
Almost like you've had too much salt. Or
yeah, but only on one arm. Yes, those are the symptoms.
And then so a heaviness is probably like kind of feeling a weighted kind of feeling, I guess.
Yeah.
All right. When should I see my doctor?
As soon as you notice any symptoms.
Suspect it.
Yes. Even if you would just like to know more about how can I prevent it, because if you've had lymph nodes removed and you don't have lymphedema, it would be great to learn more about prevention. I've had some patients that didn't get it till 20 years after their surgery. And they said, I sure wish I had known not to lift that grandchild like I was doing.
Yeah.
Yes, we talk about ways to get around that because you want to hug your grandchildren on that. But I wish I had known not to sit and crochet for 3 hours because I wouldn't have lymphedema right now. So if you have questions, you can ask your physician to refer you to a lymphedema therapist and prevent.
All right, let's see. What treatments are there for lymphedema?
There are, you can come to a certified lymphedema therapist. We do a treatment called complete decongestive therapy. It is the gold standard of treatment for lymphedema. You'll read online about some surgical approaches. Those are not effective right now. Complete decongestive therapy is 99% effective. It does work. These surgical approaches are not. Give it some more time. They're trying to modify those. You'll hear about a lymphedema pump. That's they've been around for a long time, even before 1997 when this complete decongestive therapy was first approved in the U.S. Before that, as a therapist, I was a physical therapist, we would put patients' arms in a pump, squeeze their arm. It doesn't address the problem, the missing lymph nodes, so not good. There are now some pumps. There is a pump designed by a lymphedema therapist that does manual lymph drainage on you, so it can help.
And that's kind of like massage, but it's a special massage for a lymphedema patient, right?
We manually and teach the patient how to
so
manually move this fluid. It's easy to do. Move this fluid towards healthy lymph nodes. Like if you do this, I just move some fluid from this side to this side. It's real easy to do. So, pump, that's real. There used to be, they would actually go in and cut the swollen tissue out. We now found that makes things worse, so don't do that.
Kind of like when cancer spreads after a surgery, kind of?
Yeah, well, what it does, it's called a debulking procedure, and then when they remove that tissue, they also removed a lot of lymph vessels for the arm, so then eventually the arm swells worse than it was.
So I think you were telling me that they have tried a couple of things, such as like the node transplant.
Yes.
And you were telling me something about connecting the the vessel.
One of the surgical techniques they're trying is, and it's a great idea, I was so excited when I heard about it, a lymph node transfer. So they take lymph nodes from another part of your body that can afford to lose a few, and they place them in the area where the lymph nodes were removed. Sounds awesome. But from talking to some of the surgeons that do this technique, they don't connect the lymph vessels to those nodes. So they're just kind of plopping the node in there and hoping maybe something connects. So they tell me that the lymph node does eventually die, but that it releases growth hormones, they think, when it dies, and maybe some vessels grow. It's all still just new. This is a new exploding field. We need research dollars for this. It's the least understood system.
A lymphatic system awareness month.
Yes.
Do we have one?
Yeah, there actually is a lymphedema month, but it's we're just taking baby steps. But and then there's another surgical approach that sounds really cool too, since this lymph fluid needs to be dumped back into the bloodstream. Some physicians decide, well, let's just take these vessels, since they don't have a lymph node anymore, let's connect them to a vein. Oh, good idea. So I talked to a surgeon that does that. He said, well, initially you get some good results. The arm seems to go down a little bit, but then it kind of, after a while, it doesn't, and he feels like the pressure inside the vein is so great when you connect that delicate little vessel to it, it eventually just closes back off. The connection closes back off, and so but they're trying it.
Maybe
they're
working
getting
closer. Some things that help people get a little bit of short-term relief.
You can get some short-term. Yes. So hang in there.
Good. Good to know. Is massage good for lymphedema?
So a lot of my patients ask me that because this manual technique we do looks like a massage. So and then there are massage therapists who do lymphatic massage. And it is effective to stimulate your lymph system in general. They're not typically trained to reroute lymph, which is what manual lymph drainage does.
To the healthy nodes.
Yes.
Right? Okay.
Correct. Very good. So they're not trained to do that. Some of them are. And that's really cool. But typically, they're just going to stimulate your system in general, which can really It helps a little bit.
Help
I
you
have
feel
some
better.
patients that say they go once a month and they think their lymphedema is a little bit better under control.
Okay.
You have to be careful. There are certain types of massage, like a Swedish massage, really deep tissue massage, that can actually cause inflammation in an area, redness, and that creates the production of more lymph.
Gotcha.
So they need to know what they're doing, but it's not going to fix. You cannot have a swollen arm and go to get a lymphatic massage from a massage therapist and have your arm shrink. It's not going to happen.
Not going to work.
But in conjunction with that complete decongestive therapy, it could help a little bit.
Okay. Susan McDonald is asked, what is lymphoma?
Good question, because I have a lot of patients. Had a patient today that came in crying because she thought she had lymphedema and somebody told me she was going to die.
Oh no.
Apparently they knew somebody that had lymphoma. Lymphoma is cancer of the lymphatic system. You've got Hodgkin's lymphoma, non-Hodgkin's lymphoma. Yes, that is a cancer. There are treatments for that. I do get some patients that have a swelling of a limb because they have lymphoma in their lymph nodes. We work with the doctor and work with them on that. But there are some good treatments for lymphoma.
Are they likely to have both?
Not usually.
Not usually?
Not
Okay.
usually. Usually they just have the lymphoma.
Okay.
But every now and then I'll get a patient who has enough lymphoma and enough lymph nodes in an area that, yes, their extremity may be swollen.
All right.
But treat the cancer, the lymphoma clears up, and usually they don't have long-term lymphedema.
Okay.
Like patients that have lymph nodes removed would.
That's good news. All right. Thanks, Susan. Okay. What kind of exercises are good for lymphedema?
Big movements like yoga is really good. I do love water aerobics because you get the compression of the water in addition to moving, when you make a big movement with your arms, you compress your lymph nodes. You kind of empty them a little bit. So big movements are good. Like I said, yoga, water aerobics, walking's good. Walking is really good.
Okay.
Just, you wouldn't want to do heavy weightlifting. You want to talk to your therapist before you do some weightlifting.
All right. And next question, I think you told us about this earlier, but you may can elaborate. What is complete decongestive therapy?
Yeah, I didn't really explain all of it.
All the way into it?
Yes,
Okay.
it has 4 parts.
Okay.
It needs to be performed by a certified lymphedema therapist, and which would be a PT or an OT usually that went and had further training and became a lymphedema therapist. But it consists of exercises. We teach you the right kind of exercises to do because that does move lymph.
Okay.
Skin care, which you've alluded to, that's really important. That's one of the 4 parts of this.
Good. Okay.
Meticulous skin care. So we teach our patients to take really good care of their skin. Lots of moisturizers, antibiotics, ointments, Band-Aids if they get a cut or scratch. And manual lymph drainage, which I've alluded to. It's a technique we do with our hands and we teach the patient to do on themselves. It's easy to do on yourself. So you're rerouting that lymph. And then what we found is, so that manual lymph drainage doesn't literally pull the lymph out of the swollen arm.
Okay.
It just keeps more lymph from accumulating. So you've got to do compression to move that fluid out of the swollen extremity. So we start with compression bandages, hopefully progress the patient to wearing a compression garment. Cool thing is, athletes are now wearing these things. You can get them that look like a tattoo. It's kind of become cool. So we try to progress them as quickly as we can to wearing that compression garment on their arm.
Okay, good. Ooh. Is there, that's all the questions from our Ask the Experts page. Is there anything you'd like to add about breast cancer and lymphedema in relation?
I don't know that anything I haven't already said, but I just really wish if you have breast cancer and you have surgery or radiation for your breast cancer, talk to your physician about your likelihood of lymphedema, and you can ask them. I would love to be just referred to a lymphedema therapist just for one visit. I'll even talk to you on the phone if you can't come in and just tell you how to maybe prevent lymphedema.
Okay, good. Very nice. Andrea Johnson on Facebook says, I had lymph nodes removed due to breast cancer. I don't think I have lymphedema, but I often have pain where I can barely use the arm. Should I be concerned?
That's probably stage 1 lymphedema. Okay. You're probably one of those few people that has pain with lymphedema. I have had a few over the years. So, and you probably, when it hurts, you stop overusing it, you stop using it, it settles back down. We call that stage 1 lymphedema.
So there are stages to lymphedema just like cancer stages.
Yes, there's stage 0 would mean you've had lymph nodes removed. You may be stage 0. You've had lymph nodes removed, but you don't swell.
Okay.
Stage 1, you swell, but it resolves with rest and elevation.
Okay.
Stage 2, it doesn't. It kind of has some pitting. It gets thick. You can make dents in it with your finger.
Okay.
Stage 3 is really severe. Skin changes. So, Andrea, right?
Andrea?
I would recommend that you go talk to your physician. It can be your primary care physician. Doesn't have to be a cancer doctor. And just tell them that you'd like to be referred to a certified lymphedema therapist, and let them. We can also check out your shoulder. Make sure it's not something else. It could not. It could be a neck problem. There's other things it could be.
Okay. Thanks, Andrea, and best wishes to you too. Kayleen, she said yes. That was Andrea. Kayleen Gibbs says that Ginger is incredible. That's you.
Oh, thank you.
Got a fan out there.
Thank you.
How can our viewers find out more about you and Baptist Cancer Center?
If you can go to our website, baptistcancercenter.com, or you can call 601-968-1049.
Okay. I think this is our last episode on breast cancer. One of your colleagues, Dr. Corey, will be in for Baptist Cancer Center, I believe next Friday, November the 1st, to talk about lung cancer.
Yeah, he's good.
So
He knows his
I know
stuff.
we're almost out of our pink month here. Huh?
Yeah. Well, thank y'all for letting me come.
But breast cancer is all year long, so
Yes,
be sure to
it is.
stay aware and
Yes.
You
Do
can
your
speak better
monthly
to
breast
that. Mhm.
checks. Try to catch breast cancer early. Yes, do those checks.
Right. So as I said, Dr. Corey will be here to talk about lung cancer next Friday. You can go to our Ask the Experts page on WLVT.com to send your questions for that episode, as well as see our upcoming schedule. Thank you so much for being here.
Thank you.
Thank you.
Appreciate
Thank you
it.
for your questions and for watching WLVT's Ask the Experts.